Welcome, dear friends. This is Dr. Jaitly, your cardiologist, on your video site, MuniMeterHealth, which is primarily dedicated to increase medical education and patient education to enhance the clinical outcomes, because we certainly want to narrow the gap between the knowledge that's existing with the medical fraternity and, of course, the patients at large and general public. So it's very, very crucial for us to really pursue this as a global initiative, and that has been my deepest belief, that I think we can narrow the deficit between the medical fraternity and the patient's health literacy. I think we can get a better clinical outcome. Without any further ado, I'd like to delve into a very short video here, primarily for medical students, and of course, even just as a reminder for the general public and the patients, because many times, what is angina? Angina is the pain which is actually occurring because of the lack of blood supply that's occurring within the heart. So say if you draw the heart like this is where your typical aorta comes out, and of course from the aorta emanates this artery, and there is another artery which goes around like that, and then there's another artery here which is supplying the heart. Remember, this is the right coronary artery, this is the left anterior descending artery, and this is your left circumflex. So having defined that, so whenever you have an obstruction someplace, say within the artery, you would expect this to happen. Okay, so angina is a lack of blood supply that occurs from either an obstruction within the coronaries or increased demand within the muscle, obviously. So there's an imbalance. Now, what are the other terms for angina? Some patients will define that angina could be a crushing pain. You have a constriction within the chest. Some people will define it as a tightness experience, or others will say that it's like a heaviness or maybe a heavy book sitting on the chest. Some people will define it as a pressure. It's like a huge pressure that's occurring within the chest, and mostly centrally located. Sometimes it radiates down the left arm. A squeezing type of pain has been defined also in some individuals, where the person will actually end up making a fist and say, look, this fist is pointing now in the center of the chest. Likewise, strangling, like as if somebody is really tightening up a rope around your chest, and that is a strangling type of sensation. And then, as I said, sometimes patients will define it as a weight sitting on the chest, and therefore that could be an issue as well. Indigestion, for instance, that could be like as if something like a gas pain, or pains that occur commonly after a heavy meal, or sometimes wakes you up in the middle of the night because of a burning sensation. So these are some of your pains that will occur. A choking sensation has been defined also, has been experienced by some individuals, and they end up as angina. Likewise, a severe sweating, that should be a very alarming symptom, and severe weakness, that should be a very alarming symptom, and that should bring one to a doctor's clinic or to his or her attention. And therefore, all these pains that I've defined here in a very, very short video, primarily to ascertain that, look, angina cannot be ignored, and any of these symptoms that occur should be taken into account and should be immediately brought to the doctor's attention. Okay, so again, these are some of the questions that the doctors should also ask, and obviously the medical students and residents who are training right now should immediately go back and ask their patients, on their rounds. So this is a short video just to, educate our medical fraternity and, of course, the patients. So hope you enjoyed this. And again, more shorter videos coming up. So stay tuned with MuniMeterHealth. And thank you for watching this video site, which is primarily dedicated to medical education, patient education. Thanks again. This is Dr. Jaitly.